better every year. I'm here today to bring forward information that often is not available to hopefully the MPPs, because we will be reading this later on into the media room, so they will have copies of all of our speeches. And on behalf of the many patients who are too sick to be here today, and unfortunately there are many bedridden patients at home, and people who have severe chemical sensitivities who are really house confined. They're too sick to get out of bed, too sick to do their grocery shopping, and too sick to attend their children's plays or soccer outings, etc. So they need more doctors, advocates, and politicians to take action on their behalf and make the changes. Patients are horrendously sick. They are sicker now than my AIDS patients. Why? Because AIDS has made tremendous strides in the past 10 years, and there are new medications available, so a number of the AIDS patients are able to continue on with working. Not everybody, but they certainly have made tremendous strides over the last 10 years. The problem with these areas that most patients do not have a diagnosis. It often takes between 2 to 17 years to even get a diagnosis. Most doctors don't have the training or the knowledge to diagnose these illnesses. It's not being taught in the medical schools. It's not being listed on any of the board examinations for the family practitioners or the specialists in Canada. There's a real knowledge translation problem. As a result of not getting diagnosed, people get sicker. Why? Because they push themselves and push themselves and push themselves, and they get sicker and sicker. With inadequate medical support, patients are not getting the accommodations to continue working if they are at that level of ability, or the social supports that they need. According to the 2010 statistics that are out of the Canadian Community Health Survey, 20% of patients do not have their food needs met. That means they're starving.
Yeah.
This is not acceptable. This is Canada. We can do better. For May the 12th, on the International ME Awareness Day, I'm asking that patients, caregivers, healthcare professionals in Ontario, with the MPPs that will be coming later on, join across Canada and ask our politicians to make change. We need to change 4 things. Number 1, we need to have a policy change to include these illnesses in the chronic illness category in Ontario. We are still not on this list. Number 2, we need to champion education for the medical doctors, the trainees, the healthcare advocates, the healthcare workers, the personal support workers here in Ontario, so that the medical knowledge gets translated into everyday care for the people needing it in their homes, in the offices, and in the hospitals. We need to teach the doctors so that they can diagnose these illnesses and begin to help people improve. Number 3, we need to provide treatment for these illnesses once they get diagnosed. There is no treating center here in Ontario. There is an assessment center. Women's College Hospital has an environmental health clinic where you can get a diagnosis and you can get a couple of follow-up visits, but there is no long, ongoing treatment available. I request that $750 that the healthcare tax that we all pay be supporting this area. Currently, less than $1 per person is being spent. It has to improve. Number 4, as an outreach of an ongoing treating center, new treatments can be devised and improved so that people can get better treatment over time. But there must be research dollars freed up in order to do this. Taking action on these 4 ideas can have a dramatic impact and improve the over 500,000 people here in Ontario that we know have these 3 illnesses. And probably that's just the tip of the iceberg, because these are only the people that have been diagnosed according to the Canadian Community Health Survey. If the patients are diagnosed and treated early, They have a better chance to stay at work, to return to work, and have more productive and fulfilled lives. By doing this, it would reduce the burden on the healthcare system, prevent family breakups due to the burden of illness, and allow people to have more independent lives. In conclusion, I'm asking on behalf of the patients, the over 500,000 patients in Ontario who have these illnesses, to you in the room to write your MPPs. Ideally, it would be nice if we could have a visit with each of the MPPs in Ontario, because it's by making a face to go with the name. That's how we make change. We have to have friends with our MPPs, because it's through our friendships that they see us. Right now, we're invisible, and we need to become visible. I'm asking to make these changes, these absolutely necessary changes, and help the people that are too weak, too sick, too disabled to help themselves. These are real illnesses in real people, and they deserve help. Thank you.